We are about to head to the hospital. I don't think Shauna really wants to vlog, but I'm a vlog. No, we are not pregnant. We got heart surgery today. The big one. And I'm gonna take y'all through the process of how it goes. What do you gotta say on day one?
I'm nervous.
She's nervous, but it's gonna be okay. You're headed to UVA to get her aortic valve replacement surgery, bicuspid valve. So I'm gonna learn that through the process as well. But this is video number 1. Well, we got a car vlog. So we not used to vlogging. We on the way to the hospital, to UVA in Charlottesville. Any changes on how you feeling? No. See, I'm currently driving, but you know, it's gonna be a long day. We made it to UVA. She's about to go back, about to get registered. Well, we're prepping now. Shauna's getting set up. She's getting her aortic valve replacement. So she's about to get prepped. About to do a urine sample. She's getting ready.
What they give these little CNAs blank.
Surgery before?
No, not like this.
Well, here in pre-op, I'm going to ask what feels like a lot of questions.
Okay.
And then you're also going to see someone from the anesthesia team, someone from the surgery team, one of the nurses back there is going to come out and talk to you, and they're all going to ask pretty much the same questions.
Okay.
It's very repetitive.
Back. Some people, they'll wake up, it's very common to have sore throat afterwards, as you can imagine. She'll go away after a couple days or so. Other than that, we give you the normal stuff, help with keep your blood pressure up, help you with pain afterwards, so you can get some stuff for pain in the procedure, and then some other stuff just to make sure that like the antibiotics and all that stuff to help you keep you safe, is the number one priority, and then comfortable.
Okay.
Yeah. Once the procedure's done, we won't wake you up immediately. We'll just make sure you're completely stable, doing good stuff with your body, maybe give you some medicines if we need to, and we'll take you up to the ICU.
Okay.
Silver Street, accept call.
Oh, I'll just answer this.
Okay.
Hey, Jordan.
Hey, just watch out. I got them up there.
Okay, perfect. I'll be over there in a sec.
Alright, so we got thanks.
Thanks.
Yep.
Yeah, so it's all these procedures, we take people up to the ICU afterwards because it's such a big surgery. And even if you're like stable, we want to be able to watch you more closely. So we take you up there still asleep, and the breathing tube will still be in.
Okay.
And once we give you off to the ICU team, they'll work on waking you up. They want you to be in a really
She feisty.
I was saying, I got 2 daughters, so I'm like, I know that look.
She did
You
it.
gotta have that feistiness.
She
You
got
will
a
see
new heart.
she's got some restraints on her wrist just to prevent her from pulling that tube out. As soon as it comes out, those will come right off, okay?
Okay.
Got a new heart, or new part of her heart.
Mm-hmm.
You did it, baby. You did it. Got a new heart. The aortic valve replacement was a success. She has the mechanical valve. They widened her valve. So this should last her. But this is day 1. Day 1. So she should be waking up here soon. But just want to share everything so you guys can see what the process can look like, so we can be transparent for folks who have to deal with this surgery. But the doctor said she did very, very well. So we're gonna see how the recovery process goes. I'm so happy.
Pressers, 2 and 2. Oh, maybe a little hard.
Yeah.
She was on 2 and 2. She's kind of teetering a little.
Maybe we'll do it right after shift change.
Okay.
So you guys don't have to stick around.
Mm-hmm.
Yep.
And 2 comes out. Are you cold? No? Okay. You did a great job down there. She's like, "Here's mine."
We are officially day 2. Sean's gonna try and get up and sit in the chair after one day.
She's gonna kill it.
Mm-hmm.
This is your biggest goal for today. You're doing it. You're accomplishing it right now. So all you gotta do is stand up, be up in the chair for a little bit, have some breakfast, probably some clear liquids, but good. So doing great, baby. Keep it up. All right, now you're gonna have a step up. Beautiful. Good job. Great job.
Just pulling on my neck.
Yep, you got it. She's like, you're not going to do this anymore. It's okay. Here, we might have to scoot you back some, okay? Just stand, sit forward for a second. We're going to pull you back with the pad. I'll put another pillow back there too, okay?
All right, so night 1 was a little rough. Shauna only slept so much. Was up maybe every hour just because she couldn't get comfortable. And rightfully so. It was the first night after a 6-7 hour surgery. So, but on the positive note, she is already sitting up in the chair. We just got out of the chair. I got her up and on the chair at 6 this morning. So she's moving. So I think we're also going to try to walk today on day 2, which I think is amazing. Amazing step forward. So I don't know, we may be getting out here a little earlier. But she's doing good on day 2. And I will continue to take you guys through the process. I think as we go through more days, you guys are going to see more. The first day, obviously, not so much because it's all fresh. So only so much content on the first day. But I feel like today and the next couple of days are going to be more active. So, but she's doing good. Just a little wooziness, dizziness, you know. So we'll check back in.
A
The feeling of a comforting hug from your nana with the taste of creamy
9,
coffee.
10. Very good. You can there you go. Just blow hard if you can. There.
go.
That's where you start. 2, 3, 4, 5. Wow, it's getting more good effort. 6, 7, 8,
Why is everything so negative coming out of your mouth, huh? Can't. Well, let me tell you something.
9,
Is not a word in my vocabulary. Goodbye.
10. Good job.
Yeah,
And
so works.
Now you get to see what all the fuss is out here. All the beeping. That's always looking good. Excellent. Excellent. Let's try to make our goal at least for the Is your pain still the same?
Absolutely.
Do you want to sit and stuff?
Some break. Oh, look at you.
Just getting tired. Understandable. You're standing up really well though. You got any pets up?
There you go. No breaks.
All right.
Yeah. Your husband here is the videographer for you, so you have to make sure you're on your head.
You gotta smile.
Yep. The camera's right there. You can follow it if you'd like. Yeah. So we'll walk the same loop, okay? So, all right.
See you when you get back.
Thank you.
Making our way back
That's 2
in.
walks in one day.
Mm-hmm.
All right.
It's not bad.
Yeah, I'll just put it on top of your leg. So.
Alright. Ready? Come closer.
You should let him in.
How's your pain? Got some pain? Yeah. Alright, just keep walking.
Good job.
Did physical therapy work with her?
Mhm.
Okay.
Yep.
Do you want to maybe just get her around the side? Alright. You want to do in 3? Wait. Okay.
I got you. Take your time, babe.
Okay.
Ready? Alright.
1, 2, 3.
Alright.
Good job.
Look up. Look up. There you go. How you feel?
Yep.
Alright, so the scale is 1. Hold on you. You can go ahead and make a step.
Day 3. Yeah, you moving faster. Good job. Day 3.
Little bee sting. 1, 2, 3. All done.
All done.
Good, great. Hold it. Blow it out. Take a real good deep one. Breathe in and out. Maggie, you might want to step up to the top. Okay. And out. Real deep breath. Hold it. Breathe, breathe, breathe. There you go. In through your nose. Good job. In through your nose, out through your mouth. Good job.
Good job, baby. We're currently on day 4. It's possibly our last day in the ICU. Shauna has been progressing well. She's doing very, very good. She's walking, she's standing, still needs a little help. She is no longer on a catheter. So on day 4, she is now back to using the bathroom on her own. Can't walk to the bathroom by herself, but she's back to using the bathroom on her own. They removed a lot of tubes and wires from her. Her neck IV came out. They removed her chest tube. I think there's only 1 tube left. So on day 4, we are progressing, and we're gonna see what today has in store. Day 4. Getting up out the chair was a lot easier. All right. You ready? Sean? You ready?
Yeah.
snap here. Stitch together. So tiny, but I don't think this is gonna drag. It should be okay. All right, my dear.
All right.
You look so good. So crazy. 24 hours.
Yes.
Baby.
I see. Yeah.
I was gonna say I don't even know,
Sure.
but we could do it. We
Okay.
could do it.
I'll just stick behind.
Have you always had all of your cardiology stuff here, though? Yeah.
The last one is coming out. We're gonna have one heck of a documentary.
That's right. Last one. Alright, I'm just gonna take the dressing down first. Keep her on here. Sorry about the tape. Okay. Pull it out.
I'll home with you. It's gonna be okay.
You alright? Alright, just suture coming out here first. Okay. Tight little stitch there. Keep breathing. There you go. That's out.
As good as it gets. Metrology has shown me that there's still beauty and breath to be had. Because with 3 medicines in one inhaler, Metrology keeps my airways open and prevents future flares.
Like this part.
With 1 dose a day, Metrology improves lung function.
I don't like it. I know.
Day and night.
You ready?
Okay. Okay.
You tell me when.
Okay. Keep it counting.
Got it? Okay, I'll count to 3. And deep breath in, and then hum. And go, okay? 1, 2, 3. Done.
Oh, that was easy.
Good job. Now, there's
Day 4, we have graduated from the ICU.
I'm assuming we're not going to the ICU. Well, I can tell you we're going to ADA, so I'm assuming this is us.
We are on day 4 or 5. I've lost track at this point. But this might be the last night. She's getting her little chest bandage off today. Just heard from the doctor, said she's doing well. And we're gonna see how today goes. We're switching medicines. And yeah, we're one step closer.
Is it the first time?
Yep. No support.
Yeah.
Day 5.
You're getting videoed. Instagram. But you did it, so.
I'm walking real fast.
You feeling steady?
Okay. It's day 6.
You had it done on the 5th, right?
5th, yep.
Okay. Gotcha.
We are about to get the chest piece off. How you feeling? Good? Happy that you're going home?
Yeah.
Well, we're almost there, guys.
But then it's gonna be off, and it's gonna be great. I'm gonna try to do it quick. Satisfying some of my itches.
It wasn't like the actual, it's like the tape that was itching.
Sounds fun. Sorry.
Ooh.
You feeling okay? I know, sorry. It's a big giant Band-Aid.
Does it feel good to breathe? That's it, guys. How'd that feel? Okay. Good job. Yeah. Ready to come back down? Yeah. Good.
Will you be there at least like the first time?
Oh yeah, that's my wife, so I'll be there.
Cool.
Hello? ADA? Bye.
1 week post-operation. Look at that walk. Smooth. She doesn't look too excited at all. We're gonna wait for her to come back around, guys. And we're gonna see that glorious smile. Look at that walk. Now, you want to say something to the followers? Well, they're gonna see this and be upset at you. That's a good walk. 7 days post-operation, we are outside walking. Walking real good too. Crazy. Shauna, how you feeling?
My bones hurt.
Huh?
My bones hurt.
Bones still hurt, but you're walking good. If you guys can look at the past videos, you can see how she has progressed. She's walking so good. Almost back to normal. This is getting some fresh air. But yeah, guys, after a week, this is what it's looking like.
Maybe my chest tight.
Chest is tight. Maybe because you're working a little bit harder. Doctor said you gotta walk. Open up them lungs. Yeah, the house for sale. It's a beautiful day. All right, guys, we're back for another update. We are 3 weeks and some days in. I believe, I could be wrong about that, but Deshawna wanted to give an update on how she's feeling personally and kind of take you through a few things that, you know, she's been going through and, you know, talk about, I guess, what's next. So how you feeling, Deshawna?
I feel okay. I'm 3 weeks, 3 days post-surgery. Most days are good. Some days are bad. The only pain I have is with sneezing or when I'm brushing my teeth and I gag, coughing. But, and when I go on walks and start to breathe too hard, my chest hurts. But other than that, my pain is not that bad.
Yeah, you're getting better. You're definitely getting better. So you want to share with folks about the heart valve you have?
So I decided to go with the mechanical heart valve just for long-term reasons. I got 2 kids, so going in and out of surgeries just didn't sound like the right plan for me. So with the mechanical heart valve, I'm on a blood thinner for the rest of my life. So I go and get my blood checked every week, just to check my, RNA levels. I'm not sure if that's the right term, but I go in and get my levels checked once a week. And then depending on the levels, which I've been under since surgery, so they keep messing with my medication. So they'll keep messing with it until I get to the number, which I believe I'm supposed to be at a 2.5. I was at a 2.4. This week I went down to a 2.1, so my medication changed. And then I'll find out on this Tuesday, actually, if my medicine needs to go up or down again.
Right. Okay. So what is next as far as doctor's appointments, as far as, I guess, limitations?
So I go back to see the surgeon on July 10th.
About 2 weeks, 10 days.
So I'll find out if my chest is healed and if I can start driving again. If I'm still restricted. I mean, there's still things I still have a hard time doing, like taking a shower hurts. When I walk too much, it hurts. But I think I might end up doing the cardiac rehab just because I looked into it and it sounded like something that would be very beneficial for me. So I think I'm going to do that so that'll help me get my strength back.
Perspective from, I guess you had the surgery. How was your experience? Because I saw everything from my vision. I recorded everything, but how was your experience?
Well, one, I watched a video of a young man who had the same surgery. So I went in with a lot of anxiety about things going into my body and things coming back out once I was awake, because I saw that you were awake during the process. The hardest thing was waking up with the breathing tube. I felt like I couldn't breathe. I did not like that. But I didn't like the bed. So that actually made like my very first night. I think the first night was probably my worst night because I didn't sleep because the bed was just so uncomfortable that it made my chest was hurting, and then also the rest of my body was aching. Like my, I want to say after having 2 kids, I got like hip issues. So my hips and stuff were just aching. So I just wasn't comfortable. So I think I was excited when they came and was like, well, we just gonna get you out of the bed since you're so uncomfortable the first day. It was painful getting up, painful laying down. When it came to getting the tubes and the whatever this thing was that they had in my neck, those weren't that bad. My anxiety just made it seem like it was gonna be worse. But I mean, if they talk you through. Well, my doctors, they talked me through the process, told me what to do, and like I think they told me to yawn or hum, and that I didn't really feel anything. Only time I felt something was, I think there was like some type of wire. He pulled that out, but it didn't hurt. It was just the vibration of him pulling it out. And then there was like a cord that he pulled out that only stung, I guess you would say. When it got to the end, you said, I don't know what that looked like. Did you see it? Oh. Well, no. It was like some type of, it had something at the end of it, so that stung. But when it came to pulling out the tubes, those didn't hurt. The neck thing gave me the most anxiety, and I hummed and didn't even feel that coming out. Or the one that they put in my, it was an IV, but it was like long. That didn't hurt either coming out. So if you see other videos of those things getting pulled out, to me personally, they weren't that bad if they walk you through the process. And humming helped, I guess, a distraction for the mind.
So how was your experience with walking? I guess talk about each day of walking while in the hospital.
I want to say maybe the first day was the hardest, because like literally the day, not even 24 hours after surgery actually, because it was like 6 o'clock in the morning, and my surgery was at 12?
The day before. Yeah.
The day before, so less than 24 hours, they were getting me up out of bed. Getting up, I didn't tell the doctors, but I was a little lightheaded, not like lightheaded to the point that I was going to pass out, but just like, I guess lightheaded from, I've been laying down and the blood rushing back to my head and stuff. But the first day was hard, just because I was hooked to all these
all those cords
and IVs and stuff. But I had a little push card. I took breaks when I needed them. I guess each day was just like catching your breath is hard. The pain mask kept the pain away, so that was a plus. But just catching my breath was hard the first few days. But once I got up and started moving, I think I was doing pretty good.
Progressed real fast.
I did pretty good. And but now walking at home, I walk a little. Some days, I guess when my heart starts beating fast and I'm trying to breathe in a lot of air, my chest, and it's not pains from the decision, I guess, because it's expanding, my chest, my lungs are expanding, I guess, maybe, I don't know. So I feel a lot of pressure, and the pressure causes pain on right here with walking.
You're getting stronger every day, though. So
yeah, I'm trying to become more independent. That's one thing I will say. If you go through the surgery, you want to make sure that you have a good support system. I'm lucky to have an amazing husband to be by my side, because I don't know what I would do without him, because your support system has to do a lot. Things that they probably wouldn't think that they would have to do. So you want to make sure you're lucky enough to have somebody that loves you and are okay with taking care of you.
It's definitely a long journey, but you doing everything good so far, passing everything with flying colors. But Shauna wanted to give her perspective on things to let y'all know, you know, I guess how the journey has been, and, you know, really see, you know, how she's going to continue to progress. We'll continue to give you guys updates, but this concludes our journey for now. Surgery-wise. But you guys will be able to check out the whole video. And we definitely want to, you know, make sure we continue to give transparency on these types of surgeries so folks know what to expect, you know, going into it. So if you have questions or anything, feel free to leave a comment, and we will try to respond to as many people as possible.